So I'm a family doctor. I work at Family Health Center, which is a community health center in Worcester. The impact of COVID, the disease of COVID, has been really significant. COVID has disproportionately impacted different communities, especially hitting hard among communities of color and people who are lower income. The other piece that's been really significant has been the mental health. Every patient who I interact with now is experiencing some level of anxiety or depression or stress. I have been so glad to be part of the Reliant Foundation, to have the opportunity to be part of a foundation where we can help to address needs in a way that feels really meaningful and sustainable. There's amazing work going on in the community.
When this hit, personally, I was terrified. I reached out to our fellow nonprofits to see, were they okay? Things that we did during the beginning of the pandemic were responsive. They were, how can we help? What's going on? What's needed? Can we fund it? Reliant Foundation is a charity that focuses on community health needs, and that makes us really unique. So when you give to us, you can give with the confidence that we know where it's needed most and that that's where we're going to put the funds. In total, in the last year, we've funded 56 different nonprofits in Central Mass and in MetroWest. Let me throw at you Community Harvest Project. We made an emergency grant to help them get a water wheel planter. That was because during COVID, they couldn't bring any volunteers in. The reason we're looped in with Community Harvest is they are supplying recovery homes with that fresh produce. 𝗧𝗵𝗆, which is South Middlesex Opportunity Council, we help them with a youth home out in Framingham. It's a recovery home. That one in particular really struck myself and our trustees as one that we should help. At the end of the day, if they don't have that recovery home and if they're not able to help young adults reach recovery, what's going to happen to them? So that's one that we pretty quickly responded to. A recent grant we made supports children in foster care. What Rise Above wanted to do was build a playground so that when children have those visits with their family members, they can be at play. That's going to help hundreds of foster children in central Massachusetts. It just seems so much more normal. I hope that as we head into recovery, that's something that we can all work on together. How can we together as a community make sure that wellness and healthcare are available to all who need it?
My name is Dr. 𝗱𝗶𝗳𝗍𝗬, and it is my privilege to be the chair of the board of directors of the Reliant Foundation. I'm a pediatrician, so many of the causes that we raise money for are near and dear to my heart. We can find ways to help support the agencies that had to close down because they weren't getting funding. If we can keep them open so they can serve these individuals, then I think we're doing a pretty good thing for Central Massachusetts. And then remember, these are our people.
We can do something about the issues at hand. We can be part of the solution.
We have every reason to be hopeful and proud. All over this Central Massachusetts area, we work together.